right, good afternoon, good morning, everybody, depending on where you are. We are so happy to have you join us today. For the next hour or so, we will be talking about the NHPCO Measures of Excellence Data Collection Tool, Survey, and Dashboard. As you know, National Hospice Palliative Care Organization, we have been serving the hospice community through offering a repository of data in hospice care that encompasses the different elements of care delivery. Encompasses clinical, operational, safety, quality, and several other parts of data collection. If you have been a part of the Measures of Excellence data collection, then you probably now have a robust data repository and dashboard available to you for not only your QAPI programs, but internal reporting as well. My name is Aparna Gupta. I'm the Vice President of Quality with NHPCO. And today, with my colleague Ted Chenna, who's the data analyst with NHPCO, we will be walking through the NHPCO Measures of Excellence dataset. You may recall earlier this year, we had done a webinar around data and surveys, all those data and surveys that NHPCO offers, MOE being one of those. And we have the STAR survey as well, which is Workforce Engagement Survey. We also have the bereavement survey, which Ted will be alluding to just for a little bit as we talk about bereavement. With that, let's go ahead and get started. And we will go ahead and talk about the MOE. Agenda, a few housekeeping tips and agenda. We would love to hear, and we will engage you all in conversation. We're a quick, small but mighty tight-knit group here today. So we would love to hear from all of you, whether you have participated in MOE, whether it's your first time or whether you're contemplating participating in the MOE. It's a free benefit available to all members, and it's sort of a resource that NHPCO brings to the hospice community. If you have any questions, please feel free to add questions to the chat or raise your hand, come on camera and get off mute, and we would love to have an engaging conversation. Here's the agenda for today. For the first 5 minutes right now, what we're doing, welcome and introductions. Please feel free to add your name in the chat, where you're from, and what your role is in your organization. In the next 5 minutes or so, we'll walk through quality in hospice care, focusing more around the different elements at a very 100,000 feet level, different elements of the MOE report, the MOE survey, and how those elements can connect to what you are doing and really support you and arm you with the data that you may need. In the next 20 minutes till 2:30, Tej will walk us through the MOE metrics and participation. After that, we will look at MOE dashboard and reports. And in the last 15 minutes or so, we'll talk about data protection, what's next. There are further improvements to the survey collection method, survey and data collection method, and Q&A. With that, let's dig in. Let's talk about the MOE. NHPCO is committed to assisting hospice and palliative care providers in performing continuous quality and performance improvement activity that supports safe, effective, and timely care outcomes for patients and families. You are doing the most important work. Your organizations, your interdisciplinary team members are delivering care. And so what we are hoping to accomplish and what we're looking forward to is arming you with the data that you need, the skills, the tools, the resources that you need. The MOE report is one of those considered toolkits for you. We call it MOE because it is sort of a repository of data. It is a data collection tool. It is also a survey that you would complete every 3 months, quarterly. And it also has an interaction dashboard across multiple areas Tej will be alluding to, which you can actually utilize as you're working through your QAPI programs and your own process improvement. This MOE quarterly data collection tool tracks operational and clinical data to inform high-quality care. Data are submitted quarterly and updated in real time as new submissions arrive. So as you are submitting the data, you also have access to a dashboard, an interactive dashboard that you can play around in and work through filters and other things. MOE participants will be able to identify performance improvement opportunities and track their performance improvement efforts through the online dashboard. Remember, we've got about 46 data points in here. So huge opportunity for identifying where your organization may be looking at in terms of improvement. You can also trend your data if you've been contributing data quarter over quarter or in any regular fashion. This comprehensive data collection and benchmarking report is an exclusive NHPCO member benefit. So while the MOE data repository, the collection tool, and the survey is open to all. The report is an exclusive member benefit. We had our first report available to members last year, and it's still available to members on the MOE webpage. And that report was a collection of about 8 quarters of data across 46 data points. Just for you all to know, the MOE replaced the national data set in 2021. So that's when it was launched. Data collection 4 times a year, strongly recommended to submit data in each quarter to ensure there are no gaps in data when tracking performance and progress. To that effect, we have been soliciting feedback from very early on, asking you all, are you submitting data? If you're not submitting data, why? What can we do to help make data submission more streamlined, easy, and less of an administrative burden on you all? And so towards the end of this session, we'll talk about a key initiative and improvement that you will be seeing in the MOE data collection process. Next slide. Let's talk a little bit about the importance of tracking quality measures and benchmarking to inform quality care. What happens when we track quality measures? We're tracking because we're evaluating. And what is the way of evaluating? Through benchmarking. Where do I stand today? Where does everybody else stand today? And across where everybody's standing, from all the way to somebody who's not performing too well to somebody who's performing at a higher level, where do I fall? And that's really benchmarking, right? With the MOE dashboard that you have, you can trend your own performance, your own trends, but you can also see where you are compared to the benchmark. You have an opportunity for measurement, interpretation, and responding strategically to what's happening in your organization, helping you flourish in a competitive market and prove your organization's value to potential partners in the community. Utilize this with subjective data sources as well. What you're hearing from the field, what you're hearing from your colleagues, your interdisciplinary team members. Go back to your MOE report and look at your dashboard and see, does everything match up? You're leveraging a valuable tool, and this is included with your NHPCU membership. This is a data and resource access that cannot be obtained or replicated elsewhere. There are many data sources elsewhere, and you probably are utilizing many of those. So we encourage you to look at this data source as well and identify if there are any elements that you're not able to get anywhere else. There are a few elements that you'll find are unique to this MOE report. On the next slide, we'll talk a little bit more about the different areas that are measured. So all of these areas are measured, and these areas are intended to provide metrics on all aspects of hospice-related care, telling the following data stories. This is not an all-inclusive list, so there's much, much more. These are the stories that this tool and the report will tell you. Who provides care? Who receives care? The demographics of your patient population as well. Where the care is provided, the care setting, the range and quality of hospice services, staffing levels and volunteer data, demographics, cost and payer data, utilization of the ER and hospital resources, clinical safety data, infections, medication errors, falls. The areas specifically measured are these areas. And then in the next few slides, we'll talk about how these areas could and would connect to what's happening in your four walls. Program demographics, financial information, volunteer and bereavement services, staffing, productivity, patient data, patient infections, medication errors, falls, inpatient residential facilities. Remember, these are the data points here that this report offers. The more robust the data submission, the more robust you'll be able to pull out in terms of analysis and utilization of benchmarking and the data itself. On the next 2 slides, we'll talk about the different areas within your 4 walls, and we kept it very broad. Every organization is unique. Every organization is different and individualized in how they organize the departments. So what we've done is taken a few elements of the MOE report and the collection tool and put it under certain categories for you to sort of start thinking critically if you're not already. And if you are, then think through and see, does this make sense? Under quality, for your quality department, there are certain areas, not all inclusive, but certain areas that you may want to consider this report to provide insight into: length of stay, live discharge rates, levels of care, days of care, average daily census. From a safety perspective, falls, infections, medication errors. Now, we've got other areas also in this report. As we move on to the next slide, we will see that operations can benefit from this report as well. There are details around workforce, caseloads, IDT members, the referrals, volunteer data, on-call and after hours. Again, the data is as robust as the collection and the N, the number of surveys and responses we receive. Our job is to put those surveys together, do an analysis, provide a dashboard, and bring it back to you. Not only that, we're also available at any point in time for you to reach out to us and work through the report for any specific needs. Finance, payer mix, and productivity, demographics, provider characteristics, your beneficiary, your patient characteristics, geographical coverage, and accreditation status of the organizations that submit the data. Now with that, we'll move forward and I will hand it over to my colleague Tej to walk us through the next few slides.
Thank you. Aparna, can you hear me okay?
Yes, I can hear you.
Super, okay. Let me sort out my view here. And okay, so first off, yeah, we do want to thank everyone for joining us today. We're going to be walking through the Measures of Excellence report and data set. The MOE, Measures of Excellence, we call it the MOE, and I'll be calling it a lot just for brevity's sake, is available only to NHPCO members. It does require a DART ID for participation, which you would get when you join NHPCO. If you are in a state where the MOE is required for licensure, of which I think there is still at least one state, then you will be granted access to submit the MOE in order to meet those requirements, irrespective of NHPCO membership. There is a lot of data to collect, so we have developed a few tools which make this process as painless as possible. The first of these tools is a PDF version of the entire question set and instructions, it's quite a useful reference. It's a recommended download for anyone who's participating or in the MOE. But the downside of a PDF is that they are not ideal for editing or collecting data. Generally speaking, they're hard, you want to make a little change on a PDF, it gets very tricky. So they're not ideal for data collection. So with that in mind, we also have an Excel file, which you can download, which has all of the areas of the MOE separated into individual sheets for each section. And so you can on the slide sort of see this. It's not a great image, but you can see how you'll have this is payer mix, patient volume. So you have sheets. It's all very logically done. You can separate these sheets out into files if you want and send them out to the various departments to have them fill them out and send them back to you, which is kind of along the lines of the recommended approach. This avoids a situation where you have just one large file being sent around and edited by everyone. It just makes it a little easier. The slide right here will show sort of an example of how you might break out this assignment within your organization. You might say, send the payer mix sheet to the finance department, the patient volume over to the clinical supervisor, and so on. So this is basically what you want to use when you're collecting your data. Okay, so now we're moving on to the next slide. And this is a timeline for the current year's submissions. The data is collected quarterly for this report, and it's not required that you submit every quarter when you're participating, but it is highly recommended because it's really great when you go in and see your data in a continuous and cohesive timeline, and it's not so great when you start seeing big gaps in your own data. And that happens when you skip a submission period, you don't submit for a quarter. So if we encourage participation every quarter, it helps a lot down the road. These are the important dates for this year. The next deadline is going to be May 12th. So that's going to be the first quarter due. You can find this on the website as well. So we're going to move on to the next slide here. And this is where we'll start with the data sections and what they actually collect. So the very first section of the MOE is going to be the payer mix data, which is going to tell you who is paying for the hospice's services being provided. The way this is reported is that you select from a list of pay sources. And there are going to be long lists on some of these slides. I won't read all of the lists to you, but they are all in the instructions, and they are when you're completing the report, these are what you're going to select from. So for the pay sources, you're going to pick from this list. You have your hospice Medicare, Medicare Advantage, hospice Medicaid, and so on, down to other. And once you've got the pay sources, you're going to report them by the number of days of care from this list of options. So you have your days of routine hospice cares, your days of GIP care, general inpatient care, your days of respite care, your days of continuous care. So you report these days for all of these different pay sources. There are some important points of clarification. These are taken directly from the data collection Excel file. So they're all included in the instructions on the top of each page of that file. So one of the items, for example, that we did want to highlight is here in red. And let me let this person in. And what's going to happen is you may have patients that should be reported on more than one time if their primary pay source changes during that quarter you're reporting. So what you do there is you report the total number of days for each pay source. And so in other words, if the patient is on one pay source for X number of days, you report that in that category. Then you report that same patient in the other pay source for those appropriate number of days that they're in under that pay source. In the off chance you do have more than one pay source on a single day, maybe a transition day, for example, you count that towards the newest pay source or the current one. So the instructions have a lot of little very important details and instructions like this. And so definitely make sure you're paying attention. On the top of each sheet, you'll see clarification. And if you don't see what you're looking for, again, obviously reach out to us. We're always here to help with that. Okay, moving on to the next slide. The next set of data is going to be patient volume. Patient volume is reported by the type of admission. So we have new admissions, readmissions that are new to your hospice, readmissions from previous patients of your hospice. So you've got those broken out and defined here. Once again, a lot of text on the slide. I won't read all of it. This is all in the instructions, but you can sort of see the differences between the types of admissions that you're reporting here. We do our best to clarify so that the definitions are consistent and everyone's reporting the same data, because that's really, people are using their own definitions, becomes a bit chaotic. So we want to stick within the parameters of these definitions. And also the same goes for the referrals, which you're also going to report here in the same area. We have the definition for a referral. You will pick from a list of available options, which we did not have room for on this slide. You will see it in the Excel file. It is in the instructions, but it's not on this slide. And that's just because, unfortunately, we didn't have all the room for it, but I'll go through the list for you here briefly. The list of options for referrals are community-based physician or practice, acute care facility, long-term care facility, home health agency, ambulatory care facility, and the final option is sort of a 3-in-1. It's self/family/friend. So those are your referral options. There are, again, points of clarification for how, if you have any questions about what area where a referral should fall, you can usually refer to this and figure it out. And if you can't, reach out to us. We're happy to help. And it's not just a one-off. So, I mean, if you're listing a whole set of referrals in a certain way, you're not sure about it, it's always better to double check to make sure you're doing it the way that everyone else might be doing it, so that we're all looking at the same, apples to apples, as they say. I don't like that cliche, but yeah. Okay, so there is a very important caveat as well for this. If the number of referrals that you report is the same as the number of admissions, that's a flag to our system that something could be wrong, because hospices don't usually admit all of the patients who are referred for care. So when you're doing this, make sure that if the two numbers match up, it's a flag. It does say here that the data will be excluded from the analysis. In the time I've been here, which is a little under 2 years, I haven't seen anyone's data be excluded because of this, and nobody's reported any issues or any error messages or anything like that. And also, we don't have any noticeable gaps in the data, which would imply that this is happening at a high volume. But just note that if your referrals are the same as your admissions, that's going to be a flag, and that's something that we will need to look at as a potential data entry error. So just make a note of that. And also discharges defined in this list right here. Do note these are non-death discharges all the way up here. All of your death discharges are reported separately in their own sort of category. So we should make that red, but that's also made clear in the instructions. So that's how we'll track you'll be reporting the patient volume, okay? Moving on to the next slide here. And we're gonna get to volunteer data. With volunteer data, it's what you're reporting is fairly self-explanatory, but basically this has been a key area, at least since I've been here. And I would say because of COVID and the effect on the volume of volunteers, this is the one data point where we would love to have as much data as we can get, because there's clearly been a real impact. So the more data we can get on volunteers and how those numbers have changed especially in recent past few years, is just wonderful. So with volunteers, the more data we get, the better obviously for that. With volunteers, you can see how they're broken out here. I won't read every definition of every volunteer, but you do have your direct patient care volunteers, administrative volunteers, general support, all hospice. Then you're going to report the total number of volunteer hours and the total number of patients who receive volunteer care. You're going to be reporting you're also going to be reporting basically these 4 points of data each quarter, and you'll see how that kind of manifests itself in the visualization on the dashboard, which we'll get to in a few minutes. But you'll be reporting the number of volunteers, number of volunteer hours, volunteer visits, and volunteer phone calls for every quarter. And you'll see how that will, once you report enough quarters, you'll have a very nice looking trend line here. And it's going to be very helpful in benchmarking against how other organizations are doing with their volunteer programs. But other than that, it's fairly straightforward data collection and submission for this. Okay, so for the next slide, we have, we do, so the MOE, as Aparna mentioned, we have our own bereavement survey, which I'll touch on, but the MOE has a section to track and report bereavement services. So this is focused on the type of care and the volume of care provided by your hospice. It does tie in with our other survey, which is the evaluation of grief support services. That's also available only to NHPCO members. And that survey, the evaluation of grief support services, gathers data from the perspective of the recipients. So that could be a very nice bookend to this data from the MOE, which is bereavement data based on the services you're providing. So you can not only see the volume and how much the volume of the services you're providing, what you're providing, but also the feedback you're getting. So we have both ends of that covered for you here. But this is what you collect for the bereavement, total number of contacts. And this is where you can select from this list of services being provided. We don't have any write-in options on the MOE. So if you provide services not listed here and you want them to be listed, definitely let us know, reach out. We can always add other options, but this is what we're offering right now as far as the options for bereavement services. And again, this is what it'll look like on your dashboard. And you can see, once again, the more quarters of data you have, the more useful this all becomes. But everything you see is going to be tracked and displayed here on the dashboard. So that's bereavement. And again, that ties with the evaluation survey, which we'll share a link with that when we share the materials for this. I think that in case anyone wants to take a look at that survey, we'll also have a webinar on that coming up, I think, next month. So keep an eye out for that. Okay, and the next slide. Okay, so this slide is actually going to be a couple of slides. It's staff productivity. There is a long list of staff categories, and you can see the data that will be requested here. On the right, you will report on the types of nurses, you report on your aides, obviously physicians that are working with you. Basically, all the members of your team will fit in here somewhere in the staff categories. We look for totals in these areas, total employees, total PRN employees. We want the average if it fluctuates, total number of employees certified in hospice and palliative care, and the total number of separations. We're also going to be tracking with productivity, obviously. We're going to be tracking the number of visits made. They're tracked two different ways. You have the visits for in-person, phone, and audiovisual, which are just your standard visits. Then we have a separate tracking for these three categories in on-call and after-hour care visits. So you're going to have both types of visits tracked separately for each of these three categories. A lot of data, especially with this. This is one of those very data dense areas of the report. So I won't again read every single definition for these, but they are available in the instructions, and they're on. You will get the slide deck. I believe we share this. So this list is available, but I'm just not going to read the whole thing to you right now. So we're going to the next slide is going to tie into this. Actually, it's going to be the caseload. So we're going to go right into that. So caseloads are reported by the type of caregiver, but there are some important caveats. When we don't want to range, so everything has to be a single number here. So the caseload definitions, there was basically we don't the 2 points of clarification that we want to make here are that we do want a single number, not a range, and we don't want to include inpatient staff. Other than that, you're basically reporting on the productivity as broken out in these different staffing disciplines here. And there is some clarification here, caseload definition clarification. I'll read this one actually because this one's important. Some disciplines, such as they're all important, but this one's stressed for a reason. Some disciplines, such as chaplains and social workers, may be responsible for contacting all patients and families, but visit only a proportion of them. In this situation, include only those patients who receive visits as part of the care plan in determining caseloads. So again, this might be an area where you have some questions about should these be counted or not. And if the instructions aren't clarifying that enough for you, you definitely come to NHPCO staff. And if we don't know the answer, we'll find someone who does. So we're here to help with this. Next slide. So this is patient demographics. This is actually the simplest slide probably. So we collect 3 areas for patient demographics. We collect age, ethnicity, and race. And more straightforward you cannot get. So again, the more quarters of data we get, the more you can see how your demographics may be changing over time. So again, very valuable that you submit every quarter for this, but this is also available for everyone who's participating in the MOE, so you can sort of see who you're comparing yourself against as far as patient demographics. Okay. And the next slide is going to be, okay, so now we have emergency room visits and hospitalizations. So for this section, you will report the number of hospitalizations by the following types. So we have ED visits, observation stays, and total number of hospitalizations. You do have a list of what visit situations to include in your count and what not to include. If there's a question, again, reach out to us, but you can see here, you want to count visits to the hospital in all of the following situations. And you've got, if you've got a visit to a hospital, you're not sure, do I report this one here or not? Consult this list. And you also have a very clear definition on what you don't want to include here. So you do not include admissions to the hospital for the provision of care at the GIP level or inpatient respite level of care. You do not include hospitalizations that occurred prior to admission to hospice services. And you can see the data points that are tracked over here. We have the number of unduplicated patients who were hospitalized, total number of hospitalizations for ED visits, total number of hospitalizations for observation stays. And I think this is a total number of for hospitalization. So a lot of information on the slide, but it's actually fairly straightforward in the data Excel sheet. And if you do have questions on where to include a visit and it's not clarified here, let us know. The next part of the report is actually the patient safety data set. So right here, I'm going to pause for just a moment, and I'm going to just make sure that none of our staff have anything that they may want to interject. I've been talking for a little while, but also we're going to get into a separate, not a separate area, but an area of the MOE that is sort of, it's sort of its own thing on the side. So I mean, not on the side, but it's basically it warrants its own segment of this presentation. So we're going to take a little minute here before we move on to it. And I'll briefly read why this area is so important. We have obviously the utilization of the data for national benchmarking. We do have this data that helps with identifying factors that contribute to patient falls, infections, and medication errors, which helps to mitigate risk. It helps in individualized care planning, and also really looking at the effectiveness of your programs that you're implementing. You can see if you're getting results out of these programs you're implementing. And then also you can use this data for utilization in innovative patient safety program development. We do gather safety data in 3 areas. We gather it in patient falls, we gather medication errors, and we gather patient infections.
Tej, I wanted to just sort of highlight exactly what you're highlighting, that the patient safety data set, very important to look at. One of the reasons is because it's an interactive benchmark, right? So you'll see the rates, you'll see the benchmarks there. But that is that. Individualized care planning is very important from a quality, regulatory, and compliance perspective, in addition to the right thing to do. It's also as difficult, right? Because it's a moving target. So think about falls, think about medication errors, think about near misses, infections, any and all of those areas are sometimes moving goalposts, which means that we need to continue to update care, and we need to be able to individualize care plan. So this patient safety data set will really help your organization to zero in on how you all are doing internally, trend your own internal outcomes, but at the same time compare to benchmarks across other organizations as well. And then for you to be able to go back, and whether it's a root cause, whether it's some other sort of analysis that you all do, but really go all the way back to care planning. If and when a patient fell, or if and when a medication error occurred, what was that workflow from all the way to incident, from all the way to fall occurring, to the incident planning, that incident reporting that may have happened, to updating the care plan that may have happened, to updating the care teams, interdisciplinary care teams, to any kind of education training that may have happened. So these data sets are important, obviously, just like any other data set, but these data sets really give a key insight into your own patient safety programs organizationally.
Awesome. Thank you, Aparna. That we'll start the patient safety data set with the infections. Patient infections are tracked in 2 basic categories. Patients that were admitted to the hospice with an active infection, or patients that developed an infection after hospice. So it's really, was a patient infected when they showed up, or did they get infected? Within both of these categories, the data is collected on these types of infections. This is the full list of what you're going to be picking from. So you've got the 2 types of urinary tract infections, with and without the catheter. You got your respiratory, you got the ENT, ear, nose, and throat, skin or wounds, the IV, intravenous access, pressure area, or other. And so again, you're going to be reporting these infections, whether they had them when they came in, or did they develop them afterwards. You'll see how they display on the dashboard here. And also, you don't see it on this slide, you will on the next 2 patient safety slides. All of the patient safety data is going to also be reported by care location. So what that means is, not only will you be reporting on these 2 types of infections, you're also going to be telling us whether they happened in a home setting, such as a private residence, an inpatient hospital, IPU, hospice inpatient unit, a skilled nursing facility, a nursing facility, assisted living facility, or some other type of congregate living facility. So all of the patient safety data, not only do you track it by what it is and where it occurred, by what it is, but also where it occurred. So we can have precise data on all of that. But these are the patient infections. We're going to pop over here next to the medication errors. And actually this is where you'll see the care locations list that I just mentioned. You report this for all of these areas of patient safety. For medication errors, they're tracked by the type of error. You can see the types of errors to choose from here. These again, care location options, same as infections, but the types of errors we track are wrong drug administration, wrong patient, wrong dosage, error in prescription writing, error in medication dispensing, an error in medication delivery, a near miss, a total adverse reaction with the result of harm, and an adverse reaction will result in a sentinel event, which we will cover sentinel events on their own slide. But so again, this is how your medication error data is going to look. And you can see the different numbers reported each month. And basically, when you're on your dashboard and you highlight these, you can see further callouts and breakouts. But this is essentially what you're going to end up getting. And it's a very handy visualization. You can sort of track and see. And if you have anything that's a significant factor that's causing a huge increase in errors, for example, that's one of those things that stands out fairly obviously in data like this. So very useful information to track and have. The next slide is patient falls. So patient falls are similar to infections because they're going to be categorized in two categories, and these two categories are witnessed or not witnessed. So within those categories, you're going to report the following results. So these are the injury types for a fall event. You have no injury, self-explanatory. Minor is going to be very minimal Band-Aid or protective dressing. A moderate is something that may require some sutures. Major is something that will require surgery, and death, again, self-explanatory. So you've got these types of injuries, either witnessed or not witnessed. So you're going to report these, and you're also going to report where they happened, just like with the other two patient safety areas. So you've got your home, again, same list. So you're going to have that for all three of these areas of patient safety data. But sentinel events are basically how they're defined here is a sentinel event is an unexpected occurrence involving death or serious physical or psychological injury or the risk thereof. Serious injury specifically includes loss of limb or function. And you can see the phrase there, or the risk thereof, includes any process variation for which a recurrence would carry a significant chance of a serious adverse outcome. I won't read the third one, but you can. And you can see the possible outcomes of a sentinel event. You've got death, serious injury, risk of death or serious injury. You'll see how they're tracked here. And again, you're going to see witnessed and not witnessed. But these are tracked separately because of the severity, obviously, and so these will be reported on their own. And on the next slide,
just very quickly about
sure.
the sentinel events, Ted, again, make that connection across your different departments, incident reporting, ensuring that there's incident reporting that's occurring. Of course, these events are unfortunate, never events, hopefully never happen, but when they do happen, ensuring that the whole organization sort of is connected, through sort of a single nerve, right? So incident reporting is occurring, your regulatory and compliance folks, if it's all one department, that's great, but and then you're also doing your root cause. Again, reporting here from an MOE, from a data perspective, gives you a perspective of whether it's rates or whether it's some other metric that where your organization is longitudinally and where your organization has been compared to other organizations that have also submitted data within this tool, within this repository. But again, as and when these events are occurring, ensuring that you're connecting the dots within your organization, and this not being just an initiative that the quality department is working on, but including everybody all the way from executive leadership to your IDT members at the front line.
Okay. Thank you, Aparna. Okay, so that is sentinel events, and now we're going to move on to, I believe this is the last section where we're collecting data, and this is going to be on the facilities. In this area, you will report the data for every facility you have, and there is room to report for up to 5 individual facilities. And I think that was really just a matter of we had to cut data collection off at some point. So I think the limit that you can enter data for is 5, and I've never had this be an issue, but if you do find that you have an issue, you need to report on more than the number of facilities you have room for on the MOE, reach out, let us know. If you have data to report, we want it, so we'll find a way to get it. But that's something that there should be a fairly simple workaround for. But the data collected for each facility is going to cover a few slides. So here we have the methods for calculating the numbers that you'll be reporting. So you can see average length of stay, which will be reported for each level of care. You have GIP, respite, and routine. You have the average daily census calculation shown here. This is a data point that we would love to add to the filtering options of the dashboard when we get to that next. Because just imagine being able to say, okay, I only want to see information from organizations within a certain range of our average daily census. So we're working and we're hoping to get that added as a filter, but this is how you will calculate it. And we're going to move to the next slide because it's all still part of the same thing here. This is how you will report staffing by discipline, essentially. The instructions show you, again, how to calculate FTEs. It standardizes the methodology for the reporting. And I'll leave it up on this slide here. I won't read the actual calculation for you because it's the FTE calculation. And it's fairly standard. So we'll leave it on the slideshow, but we'll skip it because we're going a little tight on time here. This slide here will show the list of staffing disciplines. And the instructions do give you some additional guidance on who to include and who not to include. But if you do have questions on where someone may fall, if it's not clear for your reporting, you definitely do want to reach out to us and for help, and when we can find an answer for your question as far as where to categorize people that are not obvious. And this is what you'll be reporting for them: the total inpatient facility FTEs, total PR and employees. Again, if it fluctuates, we ask for the average. Total separations. Not the best screenshot, but you can sort of see how the data breaks out on your dashboard here as well. And the next slide is actually the dashboard. So if anyone's used the MOE, I'm sure you're somewhat familiar with it. If you've never used your dashboard, we have a video. It's about 8 minutes long. We're running a little short of time. The video is a part of the video is uploaded on the MOE webpage, so you can actually access it anytime you need to. But I think probably what we'll do here is I'll try to do a demonstration, a live demonstration of the dashboard, kind of hit on some of the major points. But first, we can just, well, let me just see if I can pull it up while we're speaking. But you can take a look at this slide, which will show you the basic layout of the dashboard. We've tried to simplify it as much as we can. And if you bear with me for just a moment, I'll pull up our dashboard and drag it over on the screen for you. But I do suggest you watch the video as well, because it does have useful information and it's always there as a resource if you need it. But let's go ahead and pull this over. So what you're looking at here is all of the measures of excellence data. Nothing is identified by program, so there's nothing here that we're concerned with as far as privacy or data protection. This view is the default view, and yours won't look quite this complicated. You won't have, for example, these private pages won't be visible. For you, you will have 13 sections here, and these are the different areas of the measures of excellence. And this is what you'll use to sort of navigate between the areas of the report. We have program demographics, financial information, all the various sections we've just covered in that order as well. So volunteer and bereavement services, You've got your, I skipped financial information. I'll just click on them and we'll let them load up as I go through. So you've got your financial information. Actually, here's an interesting note. It defaults to program demographics when you first go into your dashboard. The demographics view is unique because it's aggregated data. There's really nothing to benchmark or compare to here. So this demographics page has its own unique layout. When you move down to financial information, you'll notice a difference. All of a sudden, you'll see one side has your organization's data, the other side has NHPCO based on filter, which is the entire data set. This is everyone else's data. This is including yours. This is the cumulative MOE data set right here. And it's based on these filters up top. And we can see one's already been selected. What we'll do is reset that to default. You see all of a sudden now you're seeing data for all years everywhere. So in your view, on the left side, you'll have data for all the quarters you've actually submitted. And on this side, you'll have data for all the quarters, period, unless you've used a filter to only select certain quarters, obviously. But that's what all the rest of these pages look like. They have the side-by-side, your data, and the filter data here. So let's see, what do we want to look at? Okay, the top left of the page, you can actually take this away. If you just need a little more room on your screen, you can unpin it. Right now, it's got this little pin icon. If I just click on that, that goes away. All of a sudden, I've got a little more space. It's super handy if you're on a laptop or, just, yeah.
Sorry, can I interrupt for just a moment? The screen sharing is just showing your slide and not the live dashboard, if that's what you were hoping to present.
Yeah, that's yeah. Hang on. I was. What's it showing now?
Now we're there.
Okay. How much did I go through with one? All right, let's start again. Program, I'm going to pull this back up to the view that it was on. Okay. And we'll just forget the last 3 minutes, I guess. All right. So program demographics, this is what your dashboard defaults to when you first log in. And you can see the view here now, hopefully. And what I was explaining about things you won't see this stuff down here. This you'll basically have this section of the 13 areas of the MOE on the left-hand side of your screen. And you'll have obviously your filters up here. You will have the option to hide the filters, which just gives you a little extra screen space. I've never seen a real good use for this. You won't see any of these, but you will have your download option here. This is a very important button. This is how all of this data you're seeing gets exported for offline viewing. So let's just give you an example of what you see when you go to download your dashboard. You get this pop-up. And this is basically, you select how you want to download it. Most people will default to the PDF. You can try some other file types if you want, but really it doesn't convert well. It's set up for PDF. So we generally leave that as a PDF download if you want your report. You change your margins and everything here. One important tip on this page, you can actually download the entire report from any of the pages. So if you're looking through and you just say, okay, let's say you're looking at your staffing data. And again, by the way, sorry that this was not on screen, but this is what I was talking about when I say side-by-side data. Your organization's data is on the left, and the entire MOE data set is on the right, and it's based on the filters up here. But when you're downloading any of these dashboard pages, what you can do from the download menu here is you can actually toggle select all, and select all will just pick all of the page. It says 18, that's showing my hidden pages. For you, it'll show 13. So it'll default and you can download the whole thing anywhere you are on the MOE. That's just a little it's a kind of a little hidden thing that I didn't notice actually I think the first month or so I was here. So nobody mentioned it to me. But it's super helpful once you find it. It saves a lot of time. In fact, if you just want the whole report right away. So these are the pages. And again, I went through the list before, but just to sort of click through them so you can get an idea of what they look like and actually see them. So that's the demographics page. And this is where we start with the side-by-side comparisons here. one unique benefit of the dashboard is that it actually highlights, it has data callouts. So as you're working through it, you can just highlight any specific data point you want, and it'll show you additional information like the number of responses there. So it's all really just designed to be as user-friendly as possible. But you know, we understand that there's a lot of data here. Sometimes it does take a little time to load as well. So as you're going through the MOE, we just, and you're going from page to page, give it a second or two, especially if you just applied a filter. And I'll show you how the filters work. Actually, we have a minute or two, I think, to do that. So this is the default view of everyone. Theoretically, on this side, you would see data only for the quarters you submitted. Since we're in the administrator view right now, it's just showing me everything, saying my data is everything. But but your data would actually just show up for the quarters that you have, which is again why when you look at this, it's not very great when you see just one quarter of data and a huge gap in another quarter. And that's what unfortunately some people's dashboards look like. And that's not ideal. But let's say we want to filter this a little bit and we just want to look at data from 2023. We would just select the year filter. We'd go down here, pick 2023, and it'll automatically apply it. It'll update the count, show us how many are in the sample size here. And this would, of course, for you, it wouldn't change. For you, it would just still be your data for that period. But here you'll see all of the data for people that reported only in 2023. You could also use multiple filters. So let's say you only want data from, let's pick a state, Florida, for 2023. You do that, you get the count here. It'll show you all of the, and again, just give it a second to load, but it'll update all the charts for you automatically. This will be your data and this will be the filtered data. This is where we actually want to add that daily census to, because this will be, I think, wonderful if you were able to click here and you had an option for groups of average daily census. That's something we're working towards getting. And real quick, I'll just touch on the, there's a new page that we added at the end of last year, which is a little different as well, because it also doesn't have that side-by-side comparison yet. But this is a patient safety incident rate data. And this is a new page that people had requested this data actually for, so we decided to go ahead and just make it a part of the dashboard. And this is an incident rate calculation. So this shows you the standard rate, and I'm gonna have to look at my notes to remember the details of the calculation, but it basically shows you the occurrence of each event per 1,000 patient days. And it shows you that for all three of the patient safety areas that we measure. So you'll see the incident rates for falls, medication errors, and infections. So you'll see those broken out in two different ways. We have them listed for all the years. It's cumulative. So this is the total incident rate since the MOE started, which was 2021. And then we also have them broken out by year. And this just saves, it's just a little bit of a different view, and it saves a little time if you're just very interested in one specific period of time. You can consult this. But you'll see a rate for each of the three areas. So total of 6 charts on this page. And it's not side by side yet. It will be, hopefully. We're working to get it there. But what you would do here is you basically toggle between your DART ID. You'll have two options here, yours and everyone else's DART ID. You'll say yours or all. And to toggle back and forth, you just basically, you'll be seeing the default will be everyone's data. You would just click here and select your own DART ID. There won't be a long list for you. It'll just be yours. And that'll show you yours. So there'll be a bit of going back and forth until we get that side-by-side comparison going. But yeah, we're working on that. So anyway, we'll go back to the slideshow here, and I'm gonna try to make sure I share right this time, so or correctly. Let's see. Okay. Oops. Okay. That's not what we wanted. Bear with me, please. Okay. Sorry, bear with me, please. Okay, there we go. I apologize for that. Sarah, are we back? Can we see my the presentation screen?
Nope, we're still looking at the dashboard.
Okay. Let's stop share. And pull this up again. And there is one more area that we did want to cover very quickly. So just bear with me here while I get back to the sharing here. Can you see it now?
Yes.
Super. Okay. We'll skip this because I covered a lot of this in what I just talked about, and it is also in the video that's shared. And we also covered these new pages. We do want to touch on data protection before we end here. Data protection and the privacy of your organization, the employees and your patients is paramount to NHPCO. We have contracted with the Patient Safety Organization, and the information for this is available on the MOE webpage. So definitely take a look at that. It's a primary concern for us, so we want to emphasize that. Very quickly, we will have more information on this in the coming weeks, but we're working on a way to make this entire process a lot easier. We talked at the beginning of the presentation about how you want to collect the data by sending things around, emailing it. We really are working towards making that the bulk of your contribution. So once you've collected the data, we're hoping to implement a feature that will let you just send that file over to us, and then we would be able to go in and just upload it, have all your data available without you having to then re-enter it all yourself. So we're trying to get rid of the data entry part of it, and we're making good progress. I can't speak too much on it, but we're very excited about where we're going with that. Hopefully the easier we make it for you to submit data, the more data we'll get, and the more useful it'll be for everyone. So that we'll have information on that coming soon. So with that said, I'm sorry we ran a little long and we had a few technical issues there. I apologize. Questions and discussion, if we have any for the next few minutes, and otherwise, again, you can always email us. Sorry, we ran a little longer than I thought.
We've got a full 2 minutes for Q&A, folks.
Uh-huh.
So if there are any questions, any thoughts, any comments, like Ted said, please feel free to, add in chat or raise your hand and come off mute. We'd love to hear your thoughts around, are you utilizing MOE, and, what keeps you up at night from a data survey perspective? I see a question here. Is Minnesota the only state that requires MOE for licensure?
As far as I'm aware, yes, it is. We've not had any other states come up, and I think it's the only one. Yeah. And if you are in Minnesota and not a member, we work with the Minnesota organizations to make sure they submit and meet their requirements.
Well, I hope you found this presentation helpful. Recording will be available, and we are here to answer any questions you may have. Please contact us with any questions at moe@nhpco.org. And here is our webpage. The slide deck will be available as well. Oh, thank you, Heather. We submit and are members. Great, wonderful. And Sarah has shared here in the chat, NHPCO's virtual interdisciplinary conference is also coming up soon, April 15th to 17th, right around the corner.
It's
for more information, please feel free to, click on the link as well.
thank you everyone for joining.
Thanks, everybody. Have a wonderful rest of your day.